Welcome to Dr. Stem Cell Podcast, your ultimate companion for NEET PG preparation. I'm your host, and today we'll dive deep into the most repeated and high-yield concepts that have consistently appeared in NEET PG examinations over the past few years. Let's start with our first high-yield topic, cardiovascular physiology. One of the most frequently tested concepts is the Frank-Starling mechanism. This fundamental principle states that the stroke volume of the heart increases in response to an increase in the volume of blood in the ventricles, when all other factors remain constant. This concept appears almost every year in different forms. Now let's test your knowledge with an MCQ. Question 1. The Frank-Starling mechanism is primarily due to A. Increased heart rate, B. Increased contractility due to increased preload, C. Decreased afterload, or D. Sympathetic stimulation. The correct answer is B. Increased contractility due to increased preload. When venous return increases, the ventricles fill with more blood, stretching the cardiac muscle fibers. This optimal stretching increases the force of contraction, leading to increased stroke volume. Moving to our next high-yield area, respiratory physiology. The oxygen-hemoglobin dissociation curve is a perennial favorite. Remember the factors that cause a rightward shift: increased temperature, increased 2,3 BPG, increased PCO2, and decreased pH. This shift indicates decreased oxygen affinity, facilitating oxygen release to tissues. Let's practice another MCQ. Question 2. Which factor causes a leftward shift in the oxygen-hemoglobin dissociation curve? A. Increased temperature, B. Increased 2,3 BPG, C. Decreased pH, or D. Decreased temperature. The answer is D. Decreased temperature. A leftward shift indicates increased oxygen affinity, making hemoglobin hold on to oxygen more tightly. This occurs with decreased temperature, decreased 2,3 BPG, decreased PCO2, and increased pH. Now let's discuss pharmacology, another high-yield subject. Beta blockers are consistently tested. Remember the classification. Beta-1 selective blockers like atenolol and metoprolol primarily affect the heart, while non-selective beta blockers like propranolol affect both heart and lungs. Posing another MCQ. Question 3. Which beta blocker is contraindicated in asthma patients? A. Atenolol, B. Metoprolol, C. Propranolol, or D. All of the above. The correct answer is C. Propranolol. Being a non-selective beta blocker, it blocks beta-2 receptors in the lungs, potentially causing bronchoconstriction in asthmatic patients. Moving to anatomy and pathology. In anatomy, the cranial nerves remain a favorite topic. The facial nerve and its branches, especially the course and functions, appear frequently. Remember that the facial nerve has both motor and sensory components, with the chorda tympani carrying taste sensation from the anterior two-thirds of the tongue. In pathology, understanding the difference between neoplasia and hyperplasia is crucial. Neoplasia is autonomous growth that persists even after the stimulus is removed, while hyperplasia is controlled growth that regresses when the stimulus is withdrawn. Current year trends show increased emphasis on 1. Molecular mechanisms in physiology, 2. Newer drug classifications in pharmacology, 3. Genetic basis of diseases in pathology, 4. Clinical correlation questions, 5. Image-based anatomy questions. For this year's preparation, focus extra attention on COVID-related respiratory physiology, newer anti-diabetic drugs, molecular pathology concepts, advanced imaging anatomy, and integrated systems-based questions. Remember, the key to NEET PG success lies in understanding concepts rather than rote memorization. Practice MCQs daily. Focus on previous year question analysis and always correlate basic sciences with clinical applications. That concludes today's episode of Dr. Stem Cell Podcast. I hope this episode helped reinforce these high-yield concepts and improved your MCQ solving approach. If you found this episode valuable for your NEET PG preparation, please subscribe to Dr. Stem Cell Podcast for more such focused content. We regularly upload episodes covering all subjects with detailed explanations, current year trend analysis, and exclusive MCQ discussions. Don't forget to share this podcast with your fellow NEET PG aspirants and help them in their preparation journey. Thank you for listening, and remember, consistent preparation with the right strategy is the key to success. Until next time, keep studying and stay motivated.